thing that had the biggest impact on me was a particular patrol I went on. It was happened to be Father's Day. There was a firefight, and there was a couple of water trucks that were delivering water to this particular village that day. And in the middle of the firefight, they decided they were going to break cover and try to leave the area. We had just had a suicide guy pull out of an alleyway and detonate on us, and we couldn't be sure that that wasn't going to happen again. So immediate course of action was to stop the vehicle at all costs. And it killed a 16-year-old boy and his father. It was particularly difficult to deal with because I had a son that age. It struck home. I went home, and I don't really think I noticed I had a problem. But my wife would tell you I never smiled. We didn't talk as much. A good example is she sent me to the store when I first got back. And we were at Walmart, and she said, "Can you go get some toilet paper?" Sure. I meandered over to the toilet paper aisle. There was like 50 kinds of toilet paper, and I could not make a simple decision. I almost had a nervous breakdown right in Walmart. It for some reason frazzled me because it's just not the life I'm not used to. I mean, it's so simple, but it was such a hard decision to make. I talked to the division psychiatrist. I did not want to hear that. I did not want to hear, look, you have the classic symptoms of post-traumatic stress disorder. I was like, you've got to be kidding me, It's the last thing on the planet I wanted to hear. Normally sessions are 30 minutes to an hour. I would put the goggles on, put the headphones on, and I grab the controller and off we go on a patrol. You can't see this doctor, you can hear him. He would ask me, to talk about it. At intermittent intervals, they introduce explosions and gunfire. It's tough. It's tough because you've spent so much time trying to avoid thinking about your deployment, and they're drudging up these memories that you've tried to avoid at all costs. It's difficult. I think it was a great idea for them to put treatment in that format. Better than probably just sitting there and trying to have some doctor pull the events out of you. You're right there, boom, smack, face to face with your worst demons. I mean, am I 100% better? No, I wouldn't say I was 100% better, but I do have my life back. I'm able to do a lot of the things that I did before. I don't have so many issues. I'm not running around angry all the time. And this treatment was, it saved my life probably. It saved my marriage for sure. So I would say if you ask me if it works, yeah, it works.